Welcome to BizTechTalk. I'm Darrel Bowman, your IT professional.
And I'm Mel West, your business advisor. Thank you for joining us today and every Tuesday from noon to 1 for BizTechTalk, where we're hosting discussions with local and national business leaders.
Hey, throughout our show, we're going to be talking to a variety of high-tech professionals and business professionals about the latest technology and business trends which are happening today and coming tomorrow. You know, we've had a lot of great shows here in the last few weeks, and, you know, I got to say, thanks to the folks last week for wellness. That was an awesome topic, and today's topic is going to be really Ask a Doctor Live. We're going to be talking online and so forth. Should be fun.
It keys right in there. So, yeah, it's just another way of us to be able to bring wellness and, you know, the importance of making sure that our employees and everybody in the workplace is healthy and focused on doing the work they're hired to do. So,
oh yeah, and you know, we got to make sure you have a good synergy inside the office, man. And you can't do that if everybody's walking around sick, like our famous intern over here, Mageshin. Mageshin's over here dying in the corner, man. Thought the guy was going to pass out. I don't know why the heck he showed up. I think he said fresh air was going to keep him alive, but I just don't think so.
But yeah, but Mageshin should be going home.
Don't be spreading that stuff around, which is, by the way, one thing we should always do. If you're sick, stay home, man. Don't bring it around and give it to the people at the office, you know, or hey, Ask a Doctor Live online. We'll talk about that in a little bit.
And I'm excited to find out more about this Ask a Doctor and how it can benefit, you know, not only us as individuals, but benefit our businesses and how that's going to translate over to increased productivity.
Oh, yeah, there's going to be lots of stuff to talk about. Hey, you know, and speaking of things, you know, we always want to talk about our veterans and saying thank you very much for their services and what they've done for our country to give us the opportunities that we have. You know, I was fortunate this last weekend to stumble across at one of the festivals, the many festivals that were going on around the community, a group that was having an auction for wounded warriors. And, you know, and it was a huge group of bikers and, you know, just doing the great stuff for our veterans, and I was really proud of all those folks. I, you know, met some awesome individuals this weekend. I thought it was great.
Oh, that's great. You know, and right after our show last week, I hopped on the bike, and Madison and I rode back to South Dakota, and you know, we got there on Wednesday evening. And
what a ride for your daughter! My God, that's a long time on the back of a bike.
Oh, she did great. So it was fun. But you know, the probably the most impressive thing that we were able to do was, the next morning we got up, we went out to the Fort Meade, the Black Hills VA hospital out there, and they were having ambassador days, and where they brought in the 189th, the 139th, and 200th that had come back just a month or so ago from Iraq, Afghanistan, and Kuwait, and they had it all lined up so that they could go through all their different what would you call them? Different inspections, or, you know, basically with the doctors, have their eyes checked, their hearing, their dental, and
get that little bullet in the arm for your shot.
You know,
I see.
Get everything, you know, all in docked at one shot. You know, and out South Dakota, it's pretty rural, so getting
rural. You mean?
Yeah, rural. You know, so getting in and out is a challenge. So they've started this program out there, and I think it's fabulous. And what we were able to do was they teamed us up with one or two vets that were coming back, or National Guardsmen, and was escorting them around so that they could get to their assigned appointments on time.
So this is something you just happened to pop in and said, hey, I was going to check it all out and see what the hospital looks like out here.
Well, you know.
Or you're going, hey, man, my back is killing me. I'm going for an appointment.
You know, fortunately, the back was good, but my mom is, you know, she's a regional rep, or I forget, ambassador or something for the Christian Motorcycle Association. So she's over
excellent.
the south there, and they were looking for volunteers.
It's a biker family, awesome.
It's a biker family, yeah. And my mom
Sturgis,
and dad brought me up. So
you brought up in Sturgis, so you can't help but do that.
And unfortunately, fortunately, depending on how you look at it, I'm here this week, and Sturgis is going on, and I rode back on Saturday. It was a great, just under 1,200 miles, so coming back, but. Getting back to veterans and hiring veterans, you know, we've talked a lot about that.
Oh, yeah, definitely, man. There's a lot of opportunity here. Every show, I think we're talking about that. So what people can do. I actually was at a symposium for the GSA just yesterday, put on by the regional director, and their focus, although you know, is to increase the number of service-disabled veteran-owned businesses that they're going to be utilizing and the whole region throughout the Washington, Oregon, Idaho, and Alaska region. So I think that, you know, I don't know how much we've had to do with that, but I think it's great that they're focusing on that.
That's fantastic. You know, the other thing is, Darrell, we talk a lot about hiring vets and where to find vets to hire, and we've talked about different links. And another link is right on the Employment Security Department website, and there's an alert on the left-hand page that says "Find Veterans to Hire." And that's the best place for employers to go is right to the Washington State Employment Security Department website.
I see you say that. It's esd.wa.gov.
There you go, esd.wa.gov.
Yeah, and you know, for looking up a business for veteran-owned business, whether that's service-disabled or veteran-owned, and to verify that they're certified, you go to dva.wa.gov, which is the Department of Veterans Affairs, where they have a list of all the veteran-owned businesses that have registered in the state of Washington and have certified that they are, in fact, veteran-owned or service-disabled veteran-owned.
Well, fantastic. I think this is maybe a good place for us to take a break. We've taken care of helping our veterans out at the beginning of the show.
And we'll be right back here to talk a few minutes with Dave Hobley and Ask a Doctor Live, right?
Yep, and you're listening to Clay 1180, and this is BizTech Talk.
CloudSway removes the hassle of small business financial management. Easily upload receipts, bills, invoices, POs, and other business expenses through your mobile device, email, or scanner. CloudSway automatically scans your data and matches each transaction to your bank and credit cards. Invite staff to send their corporate receipts, allowing the team to contribute and collaborate, managing all company financial data in one location. CloudSway's reports and alerts help to guard against fraud and expense abuse. CloudSway makes it easy to protect your company's most prized possession, its financial security. Visit cloudsway.com.
Few things say more about your business than the quality of the photos in your ads and on your website. Corporate photographer Rick Doms specializes in custom photography for discriminating corporations around the world and right here in Tacoma. Rick's photos have graced the pages of Forbes, Fortune, Barron's, the Wall Street Journal, and the marketing materials of a host of great American companies. Companies like yours. See what Rick Doms photography can do for your business on the web at rickdoms.com. RICKDAHMS.com.
Are you tired of maintaining or upgrading your business technology year after year just to keep up? Moore's Law states technology will keep getting faster and smaller year after year. Office N and Icon is making Moore's Law obsolete by giving you infinite computing power. It's always new with unlimited resources. It's fast, affordable, secure, reliable, and flexible with endless CPU, RAM, and hard drive. Never worry about a virus, upgrades, backups, or patches again. With Office N and Icon, your office is anywhere at any time from any device. Unleash your power at OfficeNandIcon.com.
AimBiz.com brings you the life of a business website. The majority of business websites can't be found by search engines, so their owners lose customers and money. An AIM Business website wins new customers on Google and Facebook. Imagine your website with great content management, an integrated blog, clean designs, and clear messages. To top it off, at AimBiz.com, you get a free website design mock-up before you ever spend a dime. For more information, go to AimBiz.com. That's AIMBIZ.com.
Welcome back to BizTech Talk. I'm Darrel Bowman, your IT professional.
And I'm Mel West, your business advisor.
And we're here on Clay 1180 every Tuesday, noon to 1. Don't forget to visit us at BizTechTalk.net. Listen to our shows, download our podcast, and email us with your comments, suggestions, or at info@BizTechTalk.net. And I think we're on Facebook and YouTube and Google Plus and a couple other places, right? He's going.
I'm thinking maybe not Google Plus, but not Twitter.
We're on Twitter and we are on Google Plus. But I do know that. And hey, well, anyway, we talked about a little bit of healthcare and wellness last week, and today we're here talking to Dave Hobley, and he is with Ask a Doctor Live. Now, Dave is a father of 3 young, beautiful girls, and he's also a veteran of service-disabled veteran from Desert Storm. And he's got to start in entrepreneurship early in his life, as selling Kool-Aid, mowing lawns, clearing snow, things like that, and working around the neighbor with his tractor. Well, hard times hit Dave's family, and his family spent the last several years of his childhood homeless. But after joining the services, the armed services, the Air Force, and coming home from as a service-disabled veteran from Desert Storm, he began a passion for technology, and he began working in the medical field. And so far, he's done quite a bit of things, but I think the latest thing we're here to talk about is that Ask a Doctor Live. It's a 24-hour day, 365 your telemedicine, which benefits you, your family, your business, and everything right at your home. So, Dave, welcome.
Hey, and before we get into that, let's talk about what's really important, because he does some stuff on the side there.
No, seriously.
Representing the motorcycle, right?
Well, we'll talk about that in a little bit. But, hey, welcome, Dave.
Thank you. I'm glad to be here. Appreciate you having us.
Yeah. I really do appreciate you coming in and talk about that. And you do a little, promoting of a stunt rider.
That's correct. Hollywood B is a world-class XDL stunt rider.
Oh, fantastic. So he's a guy, I saw his videos, and he goes all over the place.
That's correct. We do shows all over the United States and Canada, and he is amazing.
Okay, well, enough about Hollywood B. Okay, because we're about talking about wellness and Ask a Doctor Live. So anyway, tell us a little bit about this Ask a Doctor Live. What is Ask a Doctor Live?
Well, we're a team that specializes in connecting people to doctors any time of the day, the night, 7 days a week, every day of the year. We're convenient. We're affordable access to quality physician care. We provide our members with convenient access to telephonic and secure email and video
Sounds like
consultations.
you've got a lot going on there, man.
How did you get involved with this?
Yeah, really. What did you do? What got you involved with
Well, I run a series of groups on the internet, and I wanted to find a way to provide them more benefits. And I knew a lot of people that are out there struggling, entrepreneurs, couldn't afford their own health care. I knew a lot of small businesses out there that needed to provide their employees more health care. And when I met this gentleman, Jeremy, he introduced me to our partner, who's Ameridocs, and we were able to build a strategic partnership.
Now, Ameridocs has been online for quite some time, haven't they? I know that I've searched them.
That's correct. It's a fantastic organization that has been working for years to develop telemedicine and has brought it light years ahead all the competitors.
So who does this Ask a Doctor Live provide service to?
We provide services to individuals, both insured, uninsured, or people who are interested in easier access to medical care.
Oh, okay. So I can have it as a family, or I can have it as a single person, or I can get it for my employees, or my employees can get it as part of some package, right?
That's correct. You can get it as part of a package. We can help you develop a plan for your employees, whether you share the cost or you cover that for your employees. We can provide that at a very low cost monthly fee to allow you full access to our premium plans.
Oh, fantastic. Is this a franchise?
No, it's not a franchise. Actually, we have a strategic relationship with rates negotiated that you just can't acquire without having a volume over 1 million reps.
Oh, so and that's with the Ameridocs, I take it?
That's correct. This strategic relationship gives us capability to offer you the power of Ameridocs premium plans. That means you don't pay any extra fees for all of the Ameridoc benefit at a pricing that can't be beat.
So what is exactly telemedicine?
So telemedicine is the use of information technology, including the telephone, the internet, the personal computer, your mobile devices, for diagnosing, treating, and monitoring patients' care.
So it sounds like, hey, if you got a problem, you can see that as long as you're not trying to get a stitches or anything like that, or a set of broken bone. So pretty much that kind of stuff?
That's correct. We are not here to replace your doctor. We're here to add a value-added benefit so that for those acute cases where you need to go in and be diagnosed for a cold or a respiratory problem or other issues like that, some of your general things that happen you usually run into the doctor for, we're able to do that over the telephone. And in extreme cases, we may refer you out to a specialist or refer you go back to your other doctor.
So now when you're doing this over the phone or over the internet and we talk to one of these doctors, does that information get transferred over to the general doctor then?
So we are HIPAA certified, the Health Improvement Portability and Accountability Act. So whatever you agree to release to specific individuals like your doctors, then we can release that at a time that you tell us that
so
you
it's
want
no
that
different.
available.
Your information is private.
That's correct.
Just like it was if it was in your doctor's office. But you can augment your general practitioner, I take it.
Well, actually, we provide access, obviously, to the member's record to them. And based on the HIPAA level of release that they signed, we're able to release that information to their doctor.
Oh, okay. Well, that sounds like a great opportunity. So, when you the telemedicine part, when you talk about telemedicine, is it Skype? Is it or do you have to have a camera? Are you limited? Can it be just over the phone? Tell us.
So actually, you could either schedule an appointment on the website if you prefer. You can actually have that appointment be a secure email appointment. Video is available in many states now, video consultations. Or you can actually schedule a phone call for the doctor to follow you up at a specific time. If you're interested in a quick consult, you can get a doctor on the phone generally within 5 minutes or less.
Now, is it an informational or is it diagnostic?
We do both informational and diagnostic.
How many doctors do you have to do this thing? 5 minutes? I can't get an appointment in that time, man. So you got to tell me. If I could get a doctor in 5 minutes.
I mean, usually when you're sitting in the waiting room, you're waiting 45 minutes to an hour.
Really, I'll call up to ask a doctor live and say, hey, I got this guy online. Here, meet my new doctor. So tell me, how do you actually get a doctor? How many doctors do you have?
The AmeriDocs Physician Network has a numerous plan of doctors all around the United States, in every state. They're all board-certified, evaluated physicians, and we have never had an issue with one not being available in the timeline that we tell our members that they're available. As a matter of fact, generally, it's well below the standards that we set for our organization.
I know I was kind of kidding about this thing about replacing your doctor, but can you do that? I mean, can this
Absolutely not. We do not recommend that you try to replace your doctor with our plan. We recommend that you use it to augment your medical care. So not only do we provide the consultations online, we also provide a portal that's a wealth of information for not only general medicine, but also naturopathy. So we have a huge database of information similar to WebMD. Of course, WebMD is a great model as well. And we also offer our consultations.
Now, Dave, a lot of health insurance providers provide a nurse hotline to call into. How is this different than, say, that nurse hotline?
Well, a nurse hotline is usually staffed by nurses, whether they're registered or not. They don't have the years of experience, education, and training that live actual doctors have. So it's important that if you are looking for...
Let's not go over there dissing nurses, because nurses have a valuable thing. And
they do.
A lot of them are pretty close to being as knowledgeable as doctors, given all the things they do. So I'm going to shout out to nurses out there.
Absolutely.
They're getting a more qualified
consultation.
Talk about that consultation. What does a typical consultation look like?
Well, it depends on what the member chooses. Again, if you want privacy, you can choose to consult by email. So we have a secure email system in the portal that allows them to consult back and forth with the doctor about their condition. If you want to use a telephone, we will actually... The doctor, if you need a general appointment, you can call in and get a hold of a doctor right away. But if you have a more serious condition that needs a little more diagnosis, you'll get a diagnostic appointment by scheduling that with a doctor.
That's when that blood's running all over the place, the bones sticking out.
Hopefully by then you call 911.
Yeah. I think that's a 911 call, right?
Yeah, probably.
But what kind of... treatment can you receive through these consultations?
So our doctors, depending on the condition, can provide a wide variety of suggestions to you to improve that condition. They can help you find specialists in your area if you don't already have one. They can also, on some cases, they can prescribe prescription medication to help resolve your issue, just as happens when you go into the
How
clinic.
limited are they on the prescription medication? I think it probably can't just be doing anything, right?
That's correct. They can prescribe anything within state law with exception of DEA-regulated medications. We do not prescribe
DEA.
DEA.
Class 2 stuff?
That's correct.
DEA?
That's the Drug Enforcement Agency. That's
correct.
correct.
And stuff like that. I mean, your high octane pain medications, I understand, right?
Right, that's correct. And for obvious reasons, we chose not to.
So are you guys the new telemedical marijuana docs or what?
Absolutely not. We don't deal with illegal medication.
I mean, hey, it's not a...
I think that just hit the news here just recently with some creative marketing with one of the doctors, right?
Oh, yeah, I was reading about that, where he was like, hey, how come I can't advertise? I don't get it, man.
So, Dave, where are your services available? Can I go anywhere throughout the United States, or could I be on vacation in Mexico?
Anywhere that you have access to the internet or a telephone, you can access our services. As long as you're a resident of the United States over the age of 18 and you have a membership, you can access our services. Now, if you opt for a diagnostic consultation, we can only make phone calls back within the 50 United States. So, of course, the diagnostics consultation require a short scheduling of time. The doctor calls you back, and he has to be able to call you back within the 50 states.
As long as it's a 50-state number. So if you could be down in, say, Mexico or someplace, as long as they're calling that local number or
That's correct.
a Skype number.
Right.
That's correct.
Well, what if you don't have a doc and this is all you have, and you're saying, okay, I want a doctor. I don't have a doctor. I've always been healthy all my life, and now I've been using you guys for my little backup thing, and all of a sudden I'm in a situation where you need some serious medical help. And do you guys recommend people in the local vicinity for folks?
Well, we do have an Ameridocs physician network, which we do refer people out to when necessary. But for those people who are underinsured, it's an outstanding option for them to be able to consult with a doctor to get medical treatment and referrals when necessary.
Now, Dave, when you talk about underinsured, what do you mean by underinsured?
Well,
no insurance,
no insurance, or perhaps medical plans where every time you go into the doctor, it's going to cost you $25 to $250 for a hospital visit.
Yeah, this can save you money because let's talk about fee real quick. I understand you're what, $30 or less or something.
That's
like that?
correct. If you were to purchase this without a group plan, we're only $29.95 a month.
Okay.
For a family.
So that's just one copay.
Yeah, one copay.
So
or
if
less.
you want to just save your copays and say, do I need to really go into my doc? You can do that if your doctor currently doesn't have that kind of a.
Well, and then you can take that, looking at it from an employer standpoint, and if you were either paying all the cost or splitting the cost, isn't this another way? Because all of those different visits affect your premium and stuff. So can you talk about that and how that would help an employer save some money?
Absolutely. As I understand it, a lot of employers' plans, they pay according to how often their employees are using those services. So that really drives up the cost for an employer when those people are doing that. So this allows people to take that 70% of the time that people go to a doctor or emergency room, that it really isn't needed, to be able to make a phone call, get online, consult with the doctor via phone, email, or video, and actually take care of that symptom and get a diagnosis and some relief without actually having to expend those resources.
Well, that's fantastic. Why don't we go ahead and take a break here, and when we come back, let's talk a little bit more about the physicians.
Okay, fantastic.
You're listening to KLAY, and this is BizTechTalk, and I'm Mel West, your business advisor.
And I'm Darrel Bowman, your IT professional. Looking forward to seeing you right back.
CloudSway removes the hassle of small business financial management. Easily upload receipts, bills, invoices, POs, and other business expenses through your mobile device, email, or scanner. CloudSway automatically scans your data and matches each transaction to your bank and credit cards. Invite staff to send their corporate receipts, allowing the team to contribute and collaborate, managing all company financial data in one location. CloudSway's reports and alerts help to guard against fraud and expense abuse. CloudSway makes it easy to protect your company's most prized possession, its financial security. Visit cloudsway.com.
In today's economy, doing more with less has become the standard. Feeling overwhelmed or out of control does not have to be part of that standard. If you are looking for improved profitability and better teamwork, West Business Concepts' expertise in sales, organizational development, and finance offers real-world solutions today. West Business Concepts helps you develop clarity and focus on who matters most. Gain an edge over your competition. Visit westbusinessconcepts.com today. That's westbusinessconcepts.com.
I know you've been thinking about adding video to your website. Don't put it off any longer. Your customers are about 75% more likely to purchase your product after learning about it in a video. Gabe Medina Productions is ready to help you put a face to your business and show your customers why your company is the better choice. We want to work with you because we want to see your business grow. Go to GabeMedinaProductions.com or call 206-250-0735 for more info. That's 206-250-0735.
Be a part of Tacoma's Waterfront Association, a dynamic organization dedicated to making Tacoma's waterfront a great place to visit and do business. Join them the second Wednesday of each month from 11:30 a.m. to 1 p.m. at the Crow's Nest at the Tacoma Yacht Club to hear exciting guest speakers and see what's happening on the waterfront. Be a part of the community strength. Make a difference along Tacoma's magnificent 46 miles of waterfront. For more information or to become a member of the Tacoma Waterfront Association, visit tacomawaterfront.org.
In Pierce County, 17% of residents are food insecure. That's 1 in 6 people who are unsure where their next meal is coming from. Someone you know is going hungry. What can you do about it? Help support Fish Food Banks of Pierce County. For every dollar received, Fish's 8 food bank locations can distribute $7 worth of food to families in need. To learn more about stopping hunger here in Pierce County, go to fishfoodbanks.org. That's fishfoodbanks.org.
Hey, welcome back to BizTechTalk. I'm Darrel Bowman, your IT professional, and I'm here with
Mel West, your business advisor.
Hey, don't forget, every Tuesday, noon to 1, we're right here. And we are talking with Dave Hobley about Ask a Doctor Live. And when we left, we were talking a few things about how the physicians, how everything works and so forth, and a little cost associated with it. But we didn't ask a couple things that are important, like, hey, is there a minimum age that's required for this or what?
Yes, there is. The minimum age is 18 years of age.
That's just to sign up, though,
That's
right?
to sign up. That's correct.
I can't cover my kids?
Yes, you can cover your kids with this. Again, this is not insurance coverage, but the plan benefit can cover your children, but you would have to do any communication with the doctor on behalf of your underage child.
And what happens if you have a pre-existing condition?
Pre-existing conditions are not a problem. Again, this is not an insurance plan. It's one heck of a benefit because we cover anybody regardless of pre-existing conditions.
Okay.
Oh, great.
Well, that is really good. Okay. Now, tell us about the different plans. I noticed we talk about upgrading and so forth. Is there some lower level and some upper level? What are we talking about?
I'm actually glad that you asked because with the strategic partnership that Ask a Doctor Live has with AmeriDocs, we have only premium plans. That means we have the individual plan and the family plan, which is premium and has everything that AmeriDocs offers. So we're able to extend that to our members at a very low cost.
Hey,
So is that included in the price? I'm sorry? Is that included in the
That's
price?
correct. There's no extra fees for any other part of the service that we offer under our plan.
Now, Dave, you said that to belong to this, you have to be in the United States. But are the doctors in the United States?
Yes, the doctors actually reside in all 50 United States, and we are looking in the future to expand to other countries as well.
I think we forgot about that question earlier. How many doctors does AmeriDoc have? I mean, is it hundreds?
I can't tell you the exact count right now. I do know that doctors daily are beating down our doors to join the AmeriDoc Physician Network. So I don't think we'll ever run short of the amount of doctors that we need to take care of our
Well,
clients.
we may have some doctors out there listening. What are some of the benefits that a doctor may benefit from joining this network?
Well, our doctors are paid very similarly to those doctors that are working in the hospitals, and they get the benefit and freedom of being able to work remotely and do more telework. So, of course, that's quite a benefit to
Well, they
many
all
of the
just
docs
English
out there.
speaking, or are there other languages as well?
Our doctors are experienced and trained in many different languages, but currently, as a service, we only offer English. We're working on finalizing the Spanish side, and we'll be looking at bringing on more later.
Oh, fantastic. Okay. And since you're going to be selling this, not only in Washington State, but you're going to be selling this across the nation?
That's correct.
So, again, you've got an exclusive all the way across the nation. And are you going to be, it's a pretty big endeavor for somebody here, locally speaking, to branch out and make all those sales across the nation. How do you plan on going about doing that?
Well, obviously, information technology. Technology is our path. Social media is our way to communicate and reach out to people. And in doing so, we'll be able to share our experience with them and have our clients share their experience and help them to understand what a great benefit this is.
Well, you're becoming somewhat of a social media expert in this whole process, aren't you?
Absolutely.
Okay, well, we'll talk a little bit about that in a little bit. See how you're doing to promote that.
Now, Dave, do you have any specialists in this network, or is that something you're looking at adding down the road, or
actually many
GPs or what?
Yeah. Many of our doctors are specialists or have specialties. That is not our current focus. Right now, our focus is that acute care, and we want to be able to refer people out to those specialists that that they need to see in person.
No, okay. Is this how via credit card? Do you guys take?
Yes,
you take
I take credit card. We can make other payment arrangements with organizations as well.
Okay. Now, how do you pay your physicians? For you docs out there.
And the physicians are compensated based on the services that they provide to our clients.
Okay.
So there's a whole plan. We have a whole system set up for taking care of that.
Is that for like the amount of time they spend on the phone?
That's correct.
Now, is that done through a queuing system? And is that how you make sure that they're available all the time? Or
That's correct. We have a system that's very similar, if you will, how the airlines work, and they keep their staff pilots and flight attendants available all the time. We have a very similar system, but it's a proprietary system that we won't speak a lot about because there's other people that would like to have the advanced system that we have.
We're not going to tell them what your coding is. We're just
absolutely. So we're able to keep our doctors on schedule all the time, 365 days a year, rain, sleet, and snow. So it's fantastic.
Well, how do you judge your doctors to be qualified? I mean, you got them beating down the doors, but then again, and this is no offense to anybody out there, but a person who graduates top in his class or bottom of his class, they're still doctor. So what do you do to qualify that you have somebody who's a competent doctor to be working on your staff?
Well, all of our doctors have to be board certified. They have to carry their own malpractice insurance, and they are also, which is very regulated, and they're also evaluated by the National Committee for Quality Assurance, the NCQA. Who has been improving healthcare since 1990, working with the federal government.
Do you give any kind of evaluation from the patients?
That's correct. Our physicians are all evaluated by the patients. Once a patient is finished with the consultation with that doctor, if they do it by phone, they'll be followed up with by secure email to do a survey on that doctor. Those results are shared with the doctor, and overall statistical results are shared with our board of directors and other people to ensure we're constantly improving the quality of service that we're delivering.
Now, do you share that information with
your members?
General data with your members and stuff?
Yeah, there are some avenues in which they've released that type of information. And I think really what you need to do is get out there and speak to some of the people who are experiencing our service, and those really speak to the numbers.
Well, what about getting your own? I mean, you're on there and you're doing this. Can you actually ask for a doc? You might have developed a relationship or already knows about your system.
Right. Our system is set up for queuing to queue doctors into the queue. There are situations where you may get to speak with the same doctor time and time again.
But it's not something where you're going to be able to establish a relationship with?
Not currently. That's something we are looking at doing.
And there's a lot of online relationships going on these days, but that has nothing to do with this conversation.
Let's talk a little bit about prescriptions. And is this a place where a person could actually get a prescription written?
Yes. So if a doctor determines that what he's treating you for is going to be benefited by a prescription, as long as it's not a Class 2 Drug Enforcement Agency regulated prescription, then that doctor, depending on the state laws in your state, can write you a prescription and have that transferred to your local pharmacy so you can pick that up 24 hours a day.
So they just email it or fax it over to the pharmacy?
That's correct, just like any other doctor would. The same.
Now,
same
each of these doctors, since you brought up depending upon the state thing, aren't doctors have to be licensed in each of the states that they're in or whatever?
And that's the great thing in the power of Ameridocs Physician Networks is we have board certified doctors in every state, so we have that taken care of.
So if you're calling from, let's say, New Mexico, then you're getting a doctor who is licensed in New Mexico.
And if you're not getting the doctor immediately who's licensed in New Mexico, then you will be speaking with one, or they will be speaking with that doctor in order to make sure your medications or whatever you need are taken care of. That's correct.
Now, how does this apply to the Affordable Care Act?
So the Affordable Care Act is actually implementing a lot of different telemedicine. As we've known for the last several years, telemedicine was a thing of the future, and now it's present day. The Affordable Care Act is primarily designed, as I understand it, to improve health care and make it more accessible by everybody. And telemedicine is really going above and beyond by doing that. We're not only making it accessible and affordable by most everybody, we're also making it available to anybody in all 50 states, wherever they are, no matter what.
Okay.
So, and your prescriptions, when you go out there and you get these medications, stuff like that, how do you fill those prescriptions? I mean, do they go to specific ones, or can you go to the pharmacy of your choice?
You can go to the pharmacy of your choice. They can transfer that prescription to the pharmacy of your choice.
Okay.
Now, is this a benefit that, say, you can write off on your taxes, or?
You know, I would imagine that there's different options for doing that, but you'd have to speak to your tax professional on that. Certainly an organization is providing that type of benefit to their employees would have an option for doing that.
Okay.
And I did want to make one more thing clear, is that we are not insurance coverages, so those charges that you receive at your pharmacy for those medications, you would be responsible for covering.
Okay. Now, so we pay this membership fee, okay, and a member pays a member fee. And is there any kind of consultation fee added to this thing?
Actually, normally your diagnostic consultations would incur an additional fee. Fortunately, with Ask a Doctor Live and the partnership that we have with Ameridocs, we only offer the premium plan, so those are covered, and you will not be out of pocket for any additional fees for those diagnostic consultations.
So it's one fee per month, and it's a little insurance to make sure that you can call anytime for anything. If you've got a bunch of active kids in the family, who I know we were accidents waiting to happen, and you don't know whether you need to be seen or anything like that. And newborns and stuff like that I know people with newborns and so forth, and they're constantly at the doctors because the kid gets a sniffle and it's like, oh, gotta go. And then they don't worry, he's just got a sniffle, it's okay. Well, this would be a lot faster, safer, and easier on the pocketbook and time saving, wouldn't it?
Absolutely, and that it is.
And I think this is where it's assurance, not insurance.
That's
oh
great.
yeah, I think you're right about that. I mean,
but you think about when you had your first kid or whatever, how many times you went and sat in maybe the emergency room.
I can't believe the number of times we
dealt
went
with for
that.
So
for absolutely no reason
this would
whatsoever.
Be a perfect fit for that.
And the doctor looking at you saying, it happens all the time, man, and he's just happy to take your money. But it was a half a day out of work most of the time. So this way, it's 5 minutes or 20 minutes on the phone, and now when I'm on the phone and I'm looking at you got to deal with this camera thing. How does a doctor, do they have a camera looking at this thing? And how do you know that is there some other website besides just using Skype you can just go to?
So in order to do a video consultation, that's done through our secure online portal.
Okay.
And that's only done by appointment.
And you're not going to post that on YouTube afterwards?
Absolutely not. We are regulated and by HIPAA, Health Improvement Portability and Accountability Act. We implement higher security than what is required of us.
Now, your video consultation's limited to a few states. Is that correct?
It's limited to many states.
Okay.
So let's say who isn't it limited to, or is there a list that you can talk about that probably couldn't do it in there, and. Well, while he's looking that up,
well, that's all right. Well, I mean,
you can go online and probably check that out as well.
It's on your website, right?
That's correct. And our goal is to provide that option for every state, and we're slowly working through the different requirements for every state in order to do that. But we offer it in many, many states right now.
Okay, very good. Now, you guys also offer some different counseling and therapy online as well, or through the phone?
That's correct. Not only do we have a board naturopath physicians network that's on board with us, we offer some naturopathy options for those who wish to take that option. We also offer some family counseling benefits, benefits for those who may be addicted to different things. So we have a lot of different added value and benefits available to that.
What about dietitians or anything like that?
Yes, we do. We have dietitians that can help with your health planning as well.
Oh, very cool.
That's very neat. Hey, why don't we go ahead and take a break here? And when we get back, one of the things you mentioned was the use of the social media and stuff. Maybe that'll be a great time to come back and talk about how you're
that's definitely, because you're doing some great stuff there. So you're listening to Clay 1180. I'm Darrel Bowman.
And I'm Mel West, and we'll be right back.
CloudSway removes the hassle of small business financial management. Easily upload receipts, bills, invoices, POs, and other business expenses through your mobile device, email, or scanner. CloudSway automatically scans your data and matches each transaction to your bank and credit cards. Invite staff to send their corporate receipts, allowing the team to contribute and collaborate, managing all company financial data in one location. CloudSway's reports and alerts help to guard against fraud and expense abuse. CloudSway makes it easy to protect your company's most prized possession, its financial security. Visit cloudsway.com.
Few things say more about your business than the quality of the photos in your ads and on your website. Corporate photographer Rick Doms specializes in custom photography for discriminating corporations around the world and right here in Tacoma. Rick's photos have graced the pages of Forbes, Fortune, Barron's, the Wall Street Journal, and the marketing materials of a host of great American companies. Companies like yours. See what Rick Doms photography can do for your business on the web at rickdoms.com. RickDahms.com.
AimBiz.com brings you the life of a business website. The majority of business websites can't be found by search engines, so their owners lose customers and money. An AIM Business website wins new customers on Google and Facebook. Imagine your website with great content management, an integrated blog, clean designs, and clear messages. To top it off, at aimbiz.com, you get a free website design mock-up before you ever spend a dime. For more information, go to aimbiz.com. That's AIMBIZ.com.
Be a part of Tacoma's Waterfront Association, a dynamic organization dedicated to making Tacoma's waterfront a great place to visit and do business. Join them the second Wednesday of each month from 11:30 a.m. to 1 p.m. at the Crow's Nest at the Tacoma Yacht Club to hear exciting guest speakers and see what's happening on the waterfront. Be a part of the community strength. Make a difference along Tacoma's magnificent 46 miles of waterfront. For more information or to become a member of the Tacoma Waterfront Association, visit tacomawaterfront.org.
In Pierce County, 17% of residents are food insecure. That's 1 in 6 people who are unsure where their next meal is coming from. Someone you know is going hungry. What can you do about it? Help support Fish Food Banks of Pierce County. For every dollar received, Fish's 8 food bank locations can distribute $7 worth of food to families in need. To learn more about stopping hunger here in Pierce County, go to fishfoodbanks.org. That's fishfoodbanks.org.
Welcome back to BizTechTalk. I'm Darrel, your IT professional.
And I'm Mel West, your business advisor.
Hey, we're here with Dave Hobley of Ask a Doctor Live. And when we left here, we were thinking about, we went to a break and we talked about a few things. And one of the things that came up was lab tests. You know, you're out there and you've got some things you're doing. And, you know, doctors can't really see that you're turning green. And, you know, what's your blood doing and what's your urine doing and those kinds of things. So you can go out and give lab tests, right?
That's correct. We don't actually go out and give the lab test, but what our doctors do is when they deem it's necessary, they can order a lab test at a local lab, have those results sent back to them, and they can go over that with you on the phone or through secure email or online with video through our portal.
Now, are these lab tests part of this program, or would that be something that would be covered under other insurance?
So once a member's with us for a year, then we give one free lab test a year. The lab test is actually covered.
Oh.
All right. If it's under that time or if you've already utilized that lab test, then you would be responsible for covering that either yourself or via other types of insurance that you may have. However, we can help members find the lowest cost options for them, perhaps a lab that's in our physicians network, and be able to find them a discount.
Oh, very nice. Okay, great.
Well, you know, also before we left, one of the things that we were talking about was, you know, you're getting the message out there. How are you growing this business? I mean, you are a local guy here, you know, and you came from some hard times. You've really taken upon yourself to, you know, grab the bull by the horns and say, my life is going to be this way. And, you know, I applaud you for that. That's amazing, coming from a situation where, you know, your family was homeless, and then I take it you joined the Air Force right afterwards.
That's correct.
And, you know, and more power to you, you know. And what did you do while you were in the Air Force?
Well, I did a lot, actually, between honor guard service while I was in the Air Force, taking care of our veterans and troops, and air transportation, where I was actually taking care of a lot of load planning for all the heavy aircraft that you see flying.
Wow, this is so amazing. I was an honor guard, too, and a load master, so that's really wild.
Wow, fantastic.
Well, hey, so now that you've gotten out and you've gotten into IT, you've got this going on, you've got this business happening, you know, you've got to grow it, and it doesn't happen on its own. And so I always say, if it is to be, it is up to me. So how are you going to do that using the tools at hand? What's your plan?
Well, I've been fortunate enough to have a life experience that has brought me a lot of compassion. I love people, I love being with people, and I love helping people. So this brings together my passion for technology and my passion for helping people, and allows me to reach out to more people using social media and sharing this experience with them to allow them to take a look at these plans.
So we can find you on Facebook, is what you're saying?
That's correct. You can
find us. Where do we find you?
That's right. You can find us at facebook.com/AskADoctorLive. That's one word, Ask a Doctor Live.
Okay.
Or www.askadoctorlive.com.
Okay. And so now you're on Facebook. Tell me, you know, everybody's on Facebook, and they get out there and they spend, from the average I heard the other day, 5 hours a day, which was way too much, especially if that's your employee. But, you know, what are you doing to gather people along to say, get my message out and get them involved?
Well, fortunately, and I must give
it's
a lot
different
of
from everybody else, by the way.
Yes, absolutely. I must give a lot of thanks to my friends out there. I've developed a friendship, a network I've also got some groups which we help each other out. We help businesses succeed. And in turn, that's also helped me out. And I got to say thank you to my Get Liked community. Also, I want to say thank you to all of my friends and family that have been able to share our product out. That's basically drummed up so much interest for what we're doing.
Yeah, I went on to that Get Like community. A lot of folks out there and a lot of interesting people, made a lot of contacts and just in the few short days that I've known you, I mean, I've actually met quite a few people and had interesting conversations.
Now, is this Get Like something that everybody can join, or
that's
is
correct?
It a closed community, or
it is a closed group, and the only reason I've closed the group is to be able to more effectively moderate the group and keep it clean.
So that's your group, something that you started.
That's correct. About a year ago, maybe a little over a year ago, I wanted to find a way to help more businesses get exposure online. So I developed the Get Liked community. To help people get their Facebook pages out there, get their businesses more exposure. And in turn, we've developed that not only from a group for Facebook pages and entrepreneurs, but also we have a group for poets, we have a group for authors, we have a group for models, photographers, stunt riders, and several other facets out there now that's really moving quick. It's really building up daily. We're getting more members.
So I can just see you're all over the map. I mean, it sounds we're kindred spirits here on that one.
Maybe give us 2 or 3 key things that our listeners out there could use to get their businesses
ways to work on Facebook that would be tactics or whatever to get your likes up. Besides actually going out and saying, join Get Liked.
That's correct. Well, I think the number one thing is be personable, be real, take care of people, and they'll take care of you.
And be positive. I think that's another good thing.
Absolutely.
Out there, the more positive. And anything else? I mean, as far as technically, you're going out there, you're sharing, you're inviting, you're getting in contact. What'd you do? Any keys to that?
Well, we are helping to share other people's businesses, and they're doing the same thing for us. We were fortunate enough for you guys to bring us on the radio show, which we very much appreciate.
Oh, yeah, I saw that, and I thought technology and business and a great opportunity fits right in. Awesome opportunity.
Now, talking about Get Liked, and then also going back to Ask a Doctor Live, can you give us maybe a couple success stories and how, one, you've used the Facebook, but then also with your new business, how that's working out?
Right. Well, fortunately, I've already had a construction company call me, and C&R Boger Construction is a local construction company in Kent that they installed doors and roofs and things, and they were very excited to be able to offer a new benefit to their employees. So I'll be doing a presentation for them tomorrow on the product. So that's exciting. And I have had several other people contact me to get more information about it, including a local reporter. So it's very exciting.
Oh, well, hopefully, we got the scoop, it looks like. My gosh, there we are. And everything's rolling out nationally here very shortly. And so I'm going to wish you a lot of success on that.
Thank you very much.
That should be really good. So we're going to be coming down to the into the hour here in a little bit in our conversation. One of the things that we want to make sure people know is, well, let's talk about, we hit on a little bit on cost, but do you have, again, you have personal plans, family plans, or group plans, and you have business plans?
That's correct.
Do you have any pricing you can share, or is that something that you need to parse out? Or how?
So the only pricing that I can share with you is that our family plan for an individual to come forward and buy that from us, it'll only be $29.95 a month for a whole family up to 5 members, and an individual plan of only $19.95 a month. Those are premium plans. There's no other cost to the benefit that we provide with AmeriDocs. So that's really quite a big benefit to them. Now,
so I can cover my whole family with all the things that we talked about earlier for $30 a month and save all that time going in and out of that doctor's
less
office.
than $30 a month.
Yeah,
that's correct.
That is awesome.
Is there any long-term commitment or contracts?
Nope, it's month to month. It's completely month to month. There's no other requirements, and it's just a wonderful benefit. And I did want to make one correction from something I said earlier about our languages. We do offer Spanish service now.
We do offer.
Yes.
Oh,
and
that's
I think
very
you
good.
also found out where you're located in how many states or can do the video conferencing?
Well, we're located in every state. We provide service, but currently we are certified to do the video conferencing for the diagnostic video consultations in 39 states, including the state of Washington. And we're expanding that, I think, probably a couple of weeks.
So it's pretty rapid.
Real quick on that, why wouldn't you be certified? What's the problem with being certified in other states? I mean,
well, it's no problem, but we have to make sure that we meet all the requirements legally of those states.
Okay.
So.
And we can go to AskADoctorLive.com. Hey, thanks again, Dave, for joining us. And as always, Dave and I are, Mel and I are always thankful that, we have some great people out here, and we want to promote our veterans, especially our ones that are disabled, and getting out there and sacrificing once again to build opportunities for veterans and our country. So thank you again.
Thank our vets, and look up for veterans to hire. If you're looking for something, go to the Washington State
DVA.wa.gov or ESD.wa.gov to hire a vet and look for those opportunities. And whatever you do, seek out that 1% because they deserve it.
And politely, what do?
They get stuff done because that's the job. And that's I think that's really important to know. But one of the things that we always like to say is that there's nothing you can do better for the country than employ our veterans. And here in our local community, we must have over a 24% unemployment rate, and we must reduce that down to 0 if at all possible with regards to our veterans. They deserve our respect, they deserve our opportunities, and they deserve our support. So again, thanks for joining us. I'm Darrel Bowman.
And I'm Mel West, and you've just listened to BizTech Talk on KLAY 1180.
See you next Tuesday.
CloudSway removes the hassle of small business financial management. Easily upload receipts, bills, invoices, POs, and other business expenses through your mobile device, email, or scanner. CloudSway automatically scans your data and matches each transaction to your bank and credit cards. Invite staff to send their corporate receipts, allowing the team to contribute and collaborate, managing all company financial data in one location. CloudSway's reports and alerts help to guard against fraud and expense abuse. CloudSway makes it easy to protect your company's most prized possession, its financial security. Visit cloudsway.com.
Are you tired of maintaining or upgrading your business technology year after year just to keep up? Moore's Law states technology will keep getting faster and smaller year after year. Office and Icon is making Moore's Law obsolete by giving you infinite computing power. It's always new with unlimited resources. It's fast, affordable, secure, reliable, and flexible with endless CPU, RAM, and hard drive. Never worry about a virus, upgrades, backups, or patches again. With Office and Icon, your office is anywhere at any time from any device. Unleash your power at officeandicon.com.
In today's economy, doing more with less has become the standard. Feeling overwhelmed or out of control does not have to be part of that standard. If you are looking for improved profitability and better teamwork, West Business Concepts' expertise in sales, organizational development, and finance offers real-world solutions today. West Business Concepts helps you develop clarity and focus on who matters most. Gain an edge over your competition. Visit westbusinessconcepts.com today. That's westbusinessconcepts.com.
I know you've been thinking about adding video to your website. Don't put it off any longer. Your customers are about 75% more likely to purchase your product after learning about it in a video. Gabe Medina Productions is ready to help you put a face to your business and show your customers why your company is the better choice. We want to work with you because we want to see your business grow. Go to GabeMedinaProductions.com or call 206-250-0735 for more info. That's 206-250-0735.
Clay Radio, your conversation station.